And so good morning and welcome to the Jersey Chamber of Commerce web chat. We're talking about testing today, an essential briefing update on the latest in testing in Jersey. It's been several months since we held one of these on this subject, and we know we have an on-island testing centre with a faster turnaround. So today is a good opportunity to take stock of where we've come from and where we are now on testing and find out what's ahead for us. Workplace testing has just been announced. So how will that work? What are the current trends? What is our testing capability? What's new for the strategy going forward? Well, to help us navigate through the complex world of COVID data and testing, I'm delighted that we're joined by the Interim Director of Public Health Policy and Strategy. That's Alex Khaldi. Alex, good morning and welcome to you. We have the Testing Programme Director, Rachel Williams. We will hopefully be joined by Dr. Ivan Muscat, the Deputy Medical Officer for Health. We know he's an extremely busy man, but he should be joining us on the line at some point. And there's also several private testing options for businesses to take. And Matt Johnson is the Director of Pharmacy at LV Care Group, who offers such a service, and he's also joining us on the panel today. Thank you very much indeed to those of you who've joined us. We have a rather large number joining us right at this second. I see the number increasing all of the time. So if you've just joined, good morning to you. We have three of our panelists there on the screen for you. Dr. Ivan should be joining us at some time throughout this morning. But Rachel, I'm going to come to you first. In fact, before I do that, let me just say there is a Q&A box at the bottom of the screen. If you have a question that you would like to ask our panel, then of course, put that question in there. We've got some pre-received questions. I see there's a phone number up there at the moment, which is quite helpful. And that, I believe, is for Dr. Ivan Muscat, who's up there at the moment. Dr. Ivan, is that you on the line, sir?
Good morning to you. Yes, it is. Apologies, I can't get through on Zoom.
Well, no problem at all. We do have you, as I say, up there at the moment, and we will just put Dr. Ivan. See, I'm changing as we go now. If only I could spell. And the reason I'm doing that is because your name comes up instead, which is much more helpful. So we have Dr. Ivan Muscat joining us on the phone as well. I'm going to start by just talking about workplace testing, if I may. And Rachel, come to you first on this. This is something new. This is something that businesses, I think, have been quite keen to see in place, which is those people that are working in the employ who might be susceptible to catching COVID-19 through the fact that their job has got a public face, a contact. There's an opportunity now for them to have free testing. Just talk us through how this is going to work.
Okay, so hopefully people will have seen the announcements last week and the back end of the week before, and also had the chance to view the government's website. So we have just announced the expansion of our workforce testing programme. We have been undertaking workforce testing over the past number of months, but focusing that specifically at the care sector, because that has been understandably the highest risk, both in terms of people working in that sector, contracting the virus, but also in terms of the vulnerability of the individuals that they look after. You may remember back in May and June time, we did offer PCR testing for an expanded workforce, and we also offered an antibody survey for anybody who worked in essential roles, in public facing roles, and we tested around about 10,000 people with that as part of that public health antibody survey. Because the number of cases is starting to rise in Jersey, and because we're starting to see some workplace transmission, some community transmission, as well as the household transmission, the decision's been made to expand out our workforce testing programme so that anybody who works effectively in a public facing role will be eligible to take a PCR test on a rolling programme of 4, 6 or 8 weeks. We've estimated there are around about 40,000 islanders that would be eligible for this testing.
You mentioned 4, 6 and 8 weeks. That's quite important. Does that vary depending on the occupation?
Yes, absolutely, it does. So individuals that would be eligible for testing every 4 weeks are those that work in with the most vulnerable islanders, the most vulnerable customers, and have the highest risk. So that's people who work in frontline health and community services, ambulance service, general practice, and those working in residential and care homes. So that's every 4 weeks. Every 6 weeks are people who work in domiciliary care, in dental practice, hospice and prison. And then every 8 weeks are individuals who work in public facing roles, but perhaps not with customers that have such a high level of vulnerability. So that might be people working in infrastructure and utilities, for example, those working in sport and leisure and recreation, those working in retail and public transport, voluntary sector, and people working in post and delivery services, just as some examples.
And when is this actually going to start, or is it already started? Is this just a ramp up?
Yeah, so it's already started. We went live last Monday. We're taking bookings now. So anybody who would like to book for workplace testing can call the helpline. That's 445566. And they are taking bookings now. The testing takes place down at the harbour. So because the number of ferries arriving has reduced significantly, but we'd already spent quite a lot of capital money getting the testing centre up and running during the summer for the ferry arrivals. We're repurposing that facility. So there is a drive-through facility and also a walk-in facility down at the harbour, and that's dedicated now for workforce testing. That's open on a Monday to Friday. At the moment, it's 11:30 till 7 p.m, Monday to Friday, and Saturdays from 8:30 till 4 p.m. But you do need to make an appointment before you go, because clearly we need to make sure that we're managing demand and we're not overwhelmed by people just turning up hoping they can get a test. We have plenty of appointments at the moment, so please encourage your workforce, your colleagues, to call the helpline, get booked in for their workforce test, and then that will roll through on the frequency as determined by where they work and the risk that you placed at. The other thing just to mention is that we are keeping those categories under review. So it may be that some sectors of the workforce will move up or down a category, depending on how the risk starts to emerge. And that's where Dr. Muscat and Alex and other colleagues come in.
I'm going to bring Alex in at that point. Alex, apologies, I did mute you at one point in there, so you'll need to unmute, and the same for Dr. Ivan and also for Matt. I muted you all in between conversations there because Nicola was pointing out there was a bit of echo going on. Alex, in terms of a workforce, if you're employing 10 people, what you'd ideally want is all 10 to be tested rather than an individual coming down from that, because I guess the testing only works better when more people do the test.
That's right. We've got for a typical firm that's customer facing with 10 employees, they're likely to be in the once every 8 weeks testing bracket, but we would like as many as possible of those employees to be tested on that basis. So yes, I mean, I think companies, businesses should do everything possible to encourage their employees to be tested, and in a way which is suitable for them. It's not only a protection to those employees, but it's also a protection to business continuity. If, for example, there's an infection in a workplace and it's caught relatively early, the risk of transmission to other members of the workforce is lower, and as a result, the business itself is under lesser threat. So we would encourage all businesses, large and small, to take advantage of the free testing that Rachel's outlined.
You almost preempted my question there, because there will be businesses say, yeah, this is great, but the last thing I want right now is to have 2 or 3 of my employees get tested and become positive. That's almost, you don't want to hear the bad news, but you're going to bury your head in the sand. But it's probably more beneficial for the business than not.
It would be, and I think sensible business owners will see that covering your eyes and hoping it goes away is liable to lead to something catastrophic. So getting tested quickly, the testing is available on a flexible basis. The hours I don't have to hand, but Rachel will, so it can be done after work or before work. But the possibility of doing it during work to ensure that your workforce is up to date and tested is something that obviously employers at their discretion could encourage. I think giving a workforce a little bit of time off work to go and be tested could be a positive thing in ensuring that people have been tested, or you can be reasonably confident that they are, as opposed to leaving it to their own personal discretion and personal time.
Okay, lots of questions coming off the back of this, and we'll bring in Dr. Ivan Muscat in a moment to talk about the cases per 100,000 in the last 14 days, because I know he's sitting there right at the moment ready to do that. Before I get to that, just a couple of questions coming in. Firstly, from Sandy Rachel, what's the cost of testing per employee? Now, you said it's free to the business, it's free to the employee. There's obviously a cost to the government in terms of investment in this.
Yes, that's right. I think the most important thing, though, is that it is free for businesses and it's free for the employee. And as Alex was saying, it's really important that people do come forwards to be tested so we can keep each other safe. Obviously, not just employees and customers, but also their family and friends and loved ones too.
Another question that's come in: is the testing open to a law firm?
If they're public facing, yes.
Right, fine. And Amy asks, with workforce testing, are the individuals to call and book for the appointment themselves, or should the employer be doing this on their behalf? Also, do employees need to submit evidence of their role or position upon booking or attending the appointment?
We'd encourage employees themselves to phone up and make their appointment. That's because they will have the information that they need to hand. And actually, if the employers did it for them, it would take just as long for the employer to run through the details for every employee. It's not mandatory. And so we need to make sure, I think, that we're encouraging people to put themselves forwards for the test, but not forcing them to do so. And we don't want people to feel under undue pressure and feel forced to have a test. When an individual phones the helpline, they'll ask for some basic details. So the name, the date of birth, the telephone number and the area in which the individual works. And that's just to make sure that people do actually work in those target public facing areas. We're expecting quite a significant amount of interest and uptake for these tests. And we want to make sure that they are targeted to those people that really, really need them. And then when an individual turns up for their test, they'll just need to take with them some form of work ID, just like with the antibody testing. So that we can make sure that we've collected the right information, because we'd like to be able to report by sector how many individuals in each sector have taken up the opportunity for workforce testing.
Okay, it's amazing the questions that we're getting at the moment are the questions that are quite easy for you to answer, but are concerns for people here. Another one I'm going to fire straight at you, Rachel, from Carly, who says, we have a business that is construction and landscaping. Can we encourage our employees to get tested? And what about the office staff?
So for construction businesses, yes, absolutely. They're on the list too. And they're every 8 weeks. For office-based staff, if they're, I think, probably a much lower priority, because this regular workforce testing is really predominantly for people who are public-facing and therefore have a greater risk.
Yeah, I think that probably answers the question. Sandy came back and said, the law firm has 115 employees. Do you consider testing necessary for office staff? So I think that it's about priorities there. I'm just wondering whether
Dr. Muscat may be able to add in here about the the relative risks depending on workplaces and encouragement of testing, but also on the encouragement and continued encouragement. Alex mentioned earlier on the business continuity. I think now, because of the number of positives that we're seeing and the transmission that we're seeing, it's more important than ever to really reiterate those messages about business continuity, contingency planning, but the critical importance of adhering to public health guidelines, whether that's in terms of safe distancing, hygiene, sanitising areas, and workplaces perhaps considering having an A team and a B team, so that if you do find that someone tests positive within your workforce, you don't take out the entire workforce through direct contacts or all in one, in one fell swoop. But I'm sure Dr. Muscat will also reiterate those public health messages.
Yep, I'm going to go to Dr. Ivan Muscat in a minute. You'll need to unmute your phone, Dr. Ivan. But it's quite interesting that Felicity just asked a question in there, which was, in the finance industry, if one employee gets tested positive, can we use this for our immediate colleagues there? So, the people are thinking about this at the same time. Dr. Ivan, I want to come to you on this broader question here of contagion in the workforce. And for those in the workplace, it's quite a difficult one to manage. We did have a very much a message of work from home if you can. We now have a message of go to work, but we have A and B teams, A, B and C teams, essential staff in, that sort of thing. What's your take on how businesses manage? Because we want to keep businesses open and we want to keep the economy running. But we want to do it safely. So are the two mutually exclusive, or can we combine the two? And Dr. Muscat, I think you're on mute at the moment, so I'd ask you to unmute your phone if you possibly can. That might be a difficult one at the moment. Well, hopefully Dr. Ivan will come back to us very shortly when he can unmute his phone. We don't have him on screen today, but we do have him on the phone, and hopefully he'll come back to us in just a second. Alex, I'm going to come to you on very much the same question there, and again, you're on mute at the moment, but I know you will unmute at any second. In terms of managing workforces, this is a real problem for employers at the moment. They want to have safety within their workforce, and having one or two people testing positive is going to be very difficult for them.
Well, let's just go through what happens if somebody does test positive in one of your members' workforces. Contact tracing will get in touch. That individual will, of course, self-isolate, and direct contacts will be established. That's through a process of discussion with the infected person to see whether contact of any substantial nature has happened over the recent period of time. So to Rachel's point about workforce bubbles, if you like, teams A, B, C, 1, 2, 3, and so on, that's a very sensible precaution, because if you are able to, again, for your team of 10 that you mentioned earlier, Murray, if you are able to perhaps arrange them in such a way that you have 2 teams of 5, that will potentially mean that the direct contacts associated with the single infected person would be probably limited to one of those bubbles and not 2. So this is a really sensible way of proceeding. It may well be in due course, it's something that we're considering, that we do provide guidance on workforce bubbles. It's something we're thinking about and working on at the moment, but at the heart of it is really common sense and continuity planning to ensure that you are at least protecting perhaps even a skeleton workforce from the main workforce to ensure that your business is able to continue operating should an infection occur.
COVID continuity planning. It's a phrase we never thought we'd be saying, but I'm sure we are now. And Simon asked a question, actually, saying hello to the panel. Are there specific protocols for contact tracing for positive tests that come out of workforce testing? So I'm assuming this is the next branch. You get a positive test within a workforce, the contact tracing then kicks in, just as you just iterated.
That's absolutely right. So we are not automatically, because somebody has tested positive, asking the whole of the workforce to go home and self-isolate. It is based on understanding who the direct contacts of that individual are. Most commonly, they will be in the household. Sometimes, very often, they will be in the workplace, but very often they'll be limited to a smaller group of individuals. Of course, we may have concerns in a workforce about what we call indirect contacts. So those are people who are, if you like, contacts of the direct contacts, and people that have come into broad proximity with the infected person in the initial stages. And sometimes it's necessary, if we have a significant concern about that wider indirect workforce, to either carry out testing or testing and self-isolation for the wider community. But that's not the general standard principle that would apply. I don't know if Rachel has anything to add to those points.
No, I think that's absolutely right, Alex. Thank you.
Excellent. I know you've been in touch. I could see you texting away to Dr. Ivan Muscat to see if you could get him to unmute his phone. I believe it's still showing as muted on my screen here, so we may have lost Dr. Ivan Muscat for the moment. And if we get him back,
is he muted centrally? Can you try to unmute him from Zoom?
That's what I've been trying to do. All I can do is ask.
I'll try and call him then.
Yeah. Thank you very much indeed. Whilst we're doing that, Matt, we know that there are private companies that are offering testing, and I know that we're talking about workplace testing coming.
Can you hear me now, Murray?
I can hear you now, Dr. Ivan. I will come back to you, Matt, I promise.
Yeah.
Whilst we've got
no, don't worry.
Thank you very much indeed for being with us. You've been listening to what's being said here in terms of the workplace. There are lots of complications with workplaces because no two workplaces are the same. I think of people using either hot desks. I think of people using office space such as boardrooms and meeting rooms. That does add complications, doesn't it, to the spread or the possible spread of COVID?
Yes, I think we need to, with increasing spread within outside the arrivals arena, we need to think about how we can work safely to obviously sustain various sectors and the economy as a whole, because we're not living in normal times. So working from home where appropriate is reasonable as the numbers start going up. Working in office spaces in a safer manner, working perhaps in bubbles so that if one person goes down, it's not the whole office that is taken down, but only a small number of people who are direct contacts. Obviously, having staggered breaks is also very helpful. That is very often where things fall down. You can maintain discipline in an office and distance in an office, but when people have tea and lunch breaks and so on, they understandably socialize during those periods, but that then makes people direct contacts. And of course, emphasizing the usual public health guidelines for the office as a whole, with distancing and hygiene in particular, and where appropriate, masks would also come into it. The whole idea, of course, is to identify individuals who are positive before an individual causes a cluster of cases, which then becomes more difficult to control. And that's why we're making efforts at this point, rather than further down the line, to act on a sort of individual basis rather than a whole group of people, which will then start taking us towards a more societal approach to our response.
Dr. Muscat, there's some very good points being made by Marcus, who's written into us, who said that this is all very good, but this is only arising because of ineffective border testing. Why don't we have effective border testing control whereby proper investment is made in testing facilities so results can come back within 3 hours, whereby no one leaves the port of entry unless they are negative, and that they test positive, then they enter a state of isolation and to an isolation facility, or show that they can effectively isolate. Now, the question that I ask from the point that Marcus is trying to make here is: have we tipped the balance that there is now more transmission of COVID within the local transmission, or are we still seeing more transmission coming in from out of Ireland?
We have tipped towards more non-arrival transmission. We still need to retain as good and efficient a border service as possible. It isn't just a question of sticking to borders for the moment. It isn't just a question of screening at the borders. The border system works if you have internal surveillance in place at the same time, because individuals who come through the border may be negative on arrival, but may be incubating the infection and may become positive after entry into the island, which is why, of course, there is isolation according to risk after entry into the island, and further testing down the line, of course. And as you all know, the sort of green, amber and red response from a testing isolation point of view is proportionate to the risk of an individual bringing infection in. And so testing, keeping people at the airport pending a result is not the only answer. It's a combination of different things, and isolation pending a result is perfectly reasonable, either in the airport or outside the airport. But you need these other things to go with it.
I'm going to share a screen right now, Dr. Muscat, which is the daily positive cases 7-day moving average, and I'm going to jump to that. I think it's slide number 6 on your list, which shows the inbound travel and the other testing and positive cases, which I think might be interesting for people to talk about. So let's just share that now so people can see that, and hopefully people can see that right now. Dr. Muscat, can you just again, just to reiterate there, I'm looking at the graph right now, and I'm looking through October. Just take us through that, if you may.
Yeah, so in pale blue are the daily positive cases based on a 7-day moving average relating to inbound travel. And if you look at September, on the left-hand side of the graph, you will see that the vast majority of cases were relating to inbound travel. But as you move into October, then about 50% were arrivals and 50% were non-arrivals. And as you go towards the end of October and the beginning of November, then there is a very clear increase in the number of non-inbound travel positive cases. And that's depicted in orange, of course.
Okay, thank you for that. I want to go to Rachel at this point. Rachel, why have we got this increase of on-island positive cases rather than inbound travel? One imagines because the inbound travel has slowed down is one thing, but that doesn't necessarily follow that we should get an increase in Ireland. So what's causing that?
Twofold. Rachel, do you want me to start with that and then add to that? So there'll be at least 2 reasons for an increase in non-arrival testing. One is that we recognize that we need to take more surveillance tests to bolster the arrival system. but also, and very importantly, we're going into winter. And as you go into winter, transmission does increase. That is why we see an increased rate of respiratory viruses, other respiratory viruses in our usual winters. And COVID is no different to that. It's just added into the other respiratory viruses. And so those are the two main explanations for the increase that we're seeing. And we've increased, of course, surveillance because we know we're going into winter, so we need to pedal faster, if you like, to pick up individual cases before they become clusters and so forth. And transmission is more common in winter because people spend more time indoors, which and in closer proximity to each other because they're indoors where there's less ventilation than outside. There's less humidity in winter, and so the droplets become aerosols more easily. So transmission as a whole is increased in winter, and that's what we're reacting to.
Dr. Muscat, thank you for taking us through that. Rachel, I'm going to come to you here on this because we're showing us a slide right now which shows the incidence of unknown source or suggested sources, as it might be. In October, workforce dinner parties, hospitality venues and healthcare site. And then in November, parties, hospitality venues and workforce social events. That's quite a worrying trend because that's people knowing it's out there but still holding events?
Yes, I think that's absolutely correct. But just add on a little to what Dr. Muscat was saying. As I'm sure people will be aware, you know, we have a really comprehensive arrivals testing program. So much so that actually it's been it's had an international interest. And a number of countries saying that they wish they were testing everyone on arrival as well. Of course, recently the numbers of arriving passengers has reduced significantly, as we expected anyway, as we go through autumn and into winter, but also as a result of our risk assessed red, amber and green country and regional programme, which obviously is encouraging people to consider carefully whether they do actually travel. What we're finding is that we're getting more travellers that are coming to Jersey are actually islanders returning rather than tourists and visitors. You asked earlier on why we were seeing an increased number of cases that were not from travel. And I think it's because there's increased awareness around symptoms. People, as we get towards autumn and winter, you know, often have coughs and colds and sniffles and sore throats and flu-like symptoms. So what's great is that people are starting to now phone the helpline more so when they get these symptoms, which means that we can identify people with those sorts of symptoms whose symptoms may be indicative of COVID rather than of a cough or a cold or a flu. So we are getting more symptomatic presentations, which is good because it helps us to manage the risk. The other positive is that our contact tracing team are working really, really hard. And so through their contact tracing, they're identifying more direct contacts. And I think the public are more aware of the need to consider who they've been with and where they've been, so that when we're phoning them for their direct contacts, we're getting much better information than we might have otherwise done, which means we can test those direct contacts and we can pick up positive cases in direct contacts. That's good. However, one of the reasons that we're picking up more positive cases in the direct contacts and in people with symptoms is exactly as you've just said, Murray. It's because people know what they should be doing. But I think because we've had perhaps, and this is just a personal comment, it's not evidence-based or scientific, I think perhaps because it's felt normal in Jersey, whilst we're actually in the middle of a global pandemic, that may be indicative that people are perhaps not adhering to those public health guidelines as much as we would like them to. It means that people are perhaps coming within 2 meters or 1 meter of one another and staying there for more than 15 minutes, that they're not wearing masks, that we're perhaps not sanitising and observing good hygiene, good hand hygiene in the way that we were at the beginning of the pandemic. And I think what we're seeing now is an increase in positive cases, because partly because of some of our own personal behaviours. As you see on the screen there, people who are holding parties, and we're hearing anecdotally of people holding parties and gathering in numbers that are more than 20, and in some cases in more than 40 people. And that is a breeding ground for COVID transmission. So we would really encourage people to please remember we are still in a global pandemic. Please remember the risk is still really high, and please be mindful. We're not asking people to sort of stop living and stop enjoying themselves, but please be mindful that it is in all of our hands to be able to help to manage the spread of COVID and to manage the transmission. And I'm sure Dr. Muscat will have more to say on that issue, as I know he is very concerned about the fact that we are still in a significantly risky global pandemic, and we need to remember that.
Yeah, I wanted to just pick up with Dr. Muscat, because I know that you have to go in about 2 minutes' time. You're onto another call, but just a word on that, if I can, Ivan. What's your feeling? Because we're going into a social time. November is notoriously a time when people start socializing. We get into winter, workforces get together. Early December is very close on us in a few weeks' time. So what's your advice for people going into this period?
I think people need to understand that much as we'd all love this coming December and Christmas to be our usual December and Christmas, it can't be with COVID thrown into the mix. We've got to approach it in a different way on this occasion. If we don't start behaving in a different way now, if we don't start being cautious about how we behave, what we do, and how we think, then there will be much more COVID around us, and the effect of that will be even greater as we go towards Christmas. So if we want to have some sort of Christmas, not the usual Christmas, but some sort of Christmas, then we need to start acting now. We need to start being careful now, so that the number of cases remain manageable, and don't run away with themselves. If they do run away with themselves, then more island-wide measures will be required, and that, of course, will spoil, if you like, the festive period significantly, much more so than caution.
Dr. Ivan Muscat, thank you for joining us. It's 10:10. I know you've got to go yourself. The others are staying on the panel, and I do want to get to Matt in just a second. But thank you very much for joining us today. No doubt we'll speak more.
Thank you. Take care. Bye.
Thank you. Thank you very much indeed to Ivan Muscat for joining us, and we will go back to our panel because we have questions that have been coming in. I'm just keeping that shot up on the screen there, Alex, before we go to Matt. The threats have been outlined already, and I think the threat there that Dr. Muscat was outlining is that if you want to have some sort of Christmas, we're going to have to think about what we do and our actions for the next 4 to 6 weeks. So with that being there, let's just go through the response. Make good decisions based on risk. What does that actually mean? Well,
we've already seen a couple of instances of unknown source events linked to workforce events. So when let's ground this in practicality, if those on the call know that their workforces are planning Christmas parties, there are a couple of choices really. One is to forego it for this year. Another is to be scrupulous in following the public health guidelines if that event is to take place. I mean, unfortunately, the combination of having a good time with alcohol, laughing and joking in an indoor environment, being close together, respiratory droplets being in the environment is the basis on which a super spreading event could occur. Now, we've talked about the risk to business already, with a sort of workforce going, going into isolation and the business continuity perhaps dropping. But I think, more widely than that, the isolation of households and large numbers of friends and families that have been direct contacts in recent past, it's not a pleasant process to go through to be at the centre of what we call a cluster of COVID cases. It's upsetting and difficult for everybody involved, although obviously our teams are as respectful and as kind as they can be in those circumstances, and carry out their work very efficiently and so on. But I think that the virus wants to infect people. That's its job, and it does it quite easily in those sorts of environments, fueled by a Christmas tipple that goes into a higher level of risk. So the choice is quite stark, really: either forego those types of events just for this year, or carry them out, but with deliberate intent to follow scrupulously the guidelines that are in place. And that's my best advice at this point for workforces.
Thank you for that. We'll come back to Rachel in just a second, and we'll come back to Alex in just a second, because we've got a stack of questions that are building up there, and we'll try and get through as many as we possibly can. Thank you for watching, and thank you for asking these questions on the Jersey Chamber of Commerce web chat that we've got. We'll come out of our screen share for just now, and we'll come back to those that we have on the screen, and go to you, Matt. Matt, you've been quite quiet for quite some time, which has been our fault there. We did mention that there are private testing, business testing that can happen, which can happen in between, and for some of those businesses that are not in that list of priority for testing there. Just take me through how that works, Matt, and businesses obviously have to pay for this, but they can have it quite regularly.
Hello. Yes, nice to have a voice at long last. Well, I mean, the whole COVID testing from pharmacy kind of fell on our lap a little bit, to be honest. It wasn't really something we intended to go through, with all the efforts we had earlier on during the initial lockdown. It was really quite busy, but we had so many patients coming in asking about testing, because a default in community health is regularly people go to their pharmacy and ask questions. And we had so many, to a point where a couple of us said, look, should we try and offer and it started with antibody testing back in April. And we tried to work as closely as we could with the government to try and at least keep on the same page. We thought it was very important to try and at least not deviate too far from what they were doing, or step on any toes at any point. And that's kind of not what we've been doing. We've been clarifying quite a lot that anyone that has any potential symptoms or is anyway potentially infected, we're not adding to that service. We are putting people straight into the hotline, as we should be. So the whole way through, we've just been trying to augment what's there, whilst not getting involved in the infected persons area. Initially, it started with antibody testing, and then it moved. We kind of agreed not to do PCR testing initially, because during the lockdown phase at the early time in March, April, PCR tested people invariably were potentially infected, which community pharmacy is not really based to do that, and that would be treading on the toes of the government side of things. But as the months went on and travel started to pick up again, PCR testing was more proving you were innocent, for want of a better phrase. So we weren't actively seeking any infected persons, and so we kind of had a chat with some people within government to try and set up a private service to help support some of those people who didn't expect to receive a PCR test in that sort of traveling situation from the government, but they couldn't access one anywhere else. And so again, we just had so many requests through community pharmacy that we kind of said, look, I suppose we should try and help this cohort of people. And then it brought us on sort of the next generation, as testing has moved forward, into businesses and how we can support business, because we've had quite a lot of business contacts coming in saying, you know, can you test for X staff on an innocence basis, rather than sort of testing people who are actively displaying symptoms within their workforce. I think businesses just want to be more secure in the service they're offering and their workforces that they have, and that they can continue to operate knowing that their staff aren't infected, and that they aren't expecting governments to be able to test them all at the drop of a hat. And I appreciate government have now launched their service too.
Okay, two questions for you. First of all, is the testing that you're doing, Matt, the same as the government testing?
Which one? The PCR testing?
Yeah.
It's not. We're using a very well-renowned lab in the UK who provide an end-to-end solution. So it's their test, it's their lab, it's their analysis. It's not a third-party test. We did have chats with government early on about PCR testing, and especially when they had their new on-site lab, but it just doesn't have capacity, and quite rightly so for the people we're looking at. I think they've sort of tried their service in-house and seen if they do have any spare capacity, and it's quite evident that it doesn't, which is no one's fault at all. But we do have to go off island, so it's not the same testing that the Jersey government have.
Okay, and in terms of cost, if businesses go, hang on a minute, yeah, we actually we probably don't fall into that priority, because there's an awful lot of people who could be tested, but are in a business. You know, we were just talking about some of those offices that are not customer facing. Is there a cost to this, and if there is, what is it?
It's not cheap. It's in and around ballpark of £175 a person, though we are trying to work with some corporates to offer them a decent discount if there's more than just one or two people getting tested. There are a lot of costs involved, unfortunately. The test itself, the lab analysis, the last pickup and earliest delivery for the couriers and everything else. But what's been tied in, I've been trying to discuss this with people within the government at the moment. We haven't quite been able to make the stars align, but the next round of testing, not PCR testing, some of the antigen testing, some of the next generation testing you've got, the accuracy is a lot better than it used to be, and they're becoming less invasive as well. So the next gen are becoming just a basic nasal swab rather than, you know, the deep brain ticklers that people talk about. And while they're not recommended for travel, they're not recognized for travel at some of the accuracy levels you're getting at 98-99% now. They make it a real viable option for people in business to get a 20-minute result, and the cost is going to be a third of that of PCR testing, so it's a lot more affordable. It's an instant result, and where we're trying to go with our business service is that we can help businesses keep the wheels turning. And I know the government can see them every 6 or 8 weeks, and that's excellent for those businesses. But if businesses need another appointment sooner, or they need someone else to help, and they're sort of out of the government option at the moment, then we're looking to augment that service that the government are providing to hopefully keep their teams working and keep the economy moving, but most importantly in a safe manner. I think that's the key objective here. Anyone that's potentially infected is still referred into the government hotline, and they're managing them completely internally. But anyone, for businesses who just want to feel a bit securer, what we'd want to offer, we can offer it, but what we'd like to get is just some, not an approval, I suppose that's the wrong word, just to say, look, actually, it's not PCR accurate, but it is pretty darn close, and it gives you a really quick turnaround on a result that we can use that with some sort of confidence with businesses or even schools, to help keep them going.
Okay. Thank you for that. I'm conscious I'm running out of time, but I appreciate that. And Alex, I'm not going to try and put you too much on the spot with this, but the next gen stuff, the antigen that's coming up here, this is all very helpful, isn't it?
Yes, it is. I'm afraid you've missed our resident expert on new testing technologies, Dr. Ivan Muscat, who would have been able to comment significantly on it. So I won't waste everybody's time by trying to do so myself, but we're constantly looking at new testing technologies, both in the UK and elsewhere. We have a pipeline of new technologies that we're trying to bring forward to the island, and conversations with people like Matt and others about the role that the private sector can play in all of that are very, very welcome.
Excellent, good. I'm going to get to questions because we've got so many of them. Jane says there appears to be a lot of mixed messages from the state's test centre to families who have children who are isolating during the current outbreak. Some are told, even with positive tests, that other members of the household do not need to isolate. Can you please clarify? Oh, Rachel, I'm going to come back to you on this. What's the difference with children isolating and the family not needing to isolate?
So different situations require different responses. As people will know, we've got a number of cases, a number of positive cases that have arisen in different schools, or I should say of students who go to different schools. We give advice based on the risk identified in each setting. It's difficult without talking about individual cases, but it doesn't appear to be that the schools are not adhering to public health guidelines. So we're tracing back cases to, for example, to parties that children have attended together. In terms of isolation guidelines, there's clear information on the government's website, and the information is that if you have a positive case or a direct contact, then those individuals must isolate for the required period of time. So for direct contacts, that they must isolate until they've had a negative result from their day 8 test. What does isolation mean? That means that in a household, the individual must isolate within that household. And if they're not able to isolate in the household, then the household needs to isolate with them.
Right, fine. Thank you for
that. What we
that.
don't want is an individual who is positive within a household, who is, sitting on the sofa with their loved ones, sitting close together, when we know that they're positive. And then those loved ones are going out and about on their daily business because they're at a much, much higher risk of transmitting the virus and therefore taking it outside of the household.
Right, last 5 minutes, quicker questions and quicker answers, I'm afraid, guys. Why does it appear we do not have a rapid response unit to test children before they enter school this week? So is there a way that we could, we've yet to offer teachers at schools testing. I think that probably comes into the workplace testing now, doesn't it? This
is a part of the workplace testing program, and it's not clinically indicated that we need to test every student before they go to school.
Right. Okay. Thank you. That's dealt with that. Should we consider cancelling office Christmas meals that are in restaurants? Oh boy, that's a tough one.
Well, I think without being a Scrooge, we carried out some spot checks of licensed premises and other premises over the course of the past week or two. That showed that there were many establishments complying incredibly well with the rules, and workforces can feel safe going to those establishments if they're behaving and the correct social distancing and public health measures are in place in that establishment. It's a safe event to carry out. But two things need to align. Both the workforce itself needs to be conscious of the public health guidelines, and it needs to go to an establishment that does ask for their contact details, maintain physical distancing, have hand washing facilities on tap. And if either of those two things go wrong, then you have the potential for a super spreading event. So you fast forward to there's a case and there's a set of infections in a licensed premise around a Christmas party, and looking back on it, were the contact details there? Were all the public health measures in place? So I think people shouldn't avoid going to their Christmas parties, but they do need to make sure they're safe and within the guidelines.
Okay, all right. Another question about this. Can employers stop employees organising workplace social events, especially with Christmas approaching? Lots of questions being raised in the office, and this is this is quite interesting that people are concerned. They want to do the right thing. I'm just not sure they know what the right thing is. Rachel.
Well, that's an interesting question. I think it's probably got a legal answer. From what I heard, the question was, can employers stop their employees organising events? I think that's a matter for individual employers to consider. I think given what Alex has just said, employers, I would strongly encourage employers to engage with their employees and make sure that if they are going to have an event, that they're doing it safely.
Mm-hmm. Okay, thank you for that. We have a small firm in a construction centre. If an employee gets tested for COVID, will that mean that everyone else on the site immediately preceding the test would also have to self-isolate for 14 days? Lots of worry about one person testing positive and from there. Presumably everyone else, as you said earlier, Alex, would then need to be tested so that you can identify that they're all safe or not.
Well, not necessarily. We'd go down the road of establishing direct contacts. I mean, it could well be in an outdoor construction site that if somebody's positive, that there's a large section of that particular workforce that they haven't come into contact with. And so we wouldn't, under normal circumstances, be mandating testing and self-isolation for the whole of the construction site in that example. If, however, we felt that we had significant concerns, there was potentially more than one infection, there were a number of public health measures not being followed, then we might step up our action on a precautionary basis, but that would be, as Rachel was attending to earlier, be on the basis of the particular characteristics of the case. But it doesn't automatically follow that once one member of the workforce is positive, everybody else has to go home, and that's an important message.
Alternatively, if the employer really feels strongly about it, they can always pay for some testing and go and see Matt and people like him that do private testing. So there are options out there. We have another question here. With the ramping up of the workforce testing and increased active case, with the ramping up of workforce testing and increased active cases from community transmission, what assurances can be given that from the tracing team that the testing turnaround time and teams and enforcement teams are sufficiently staffed and resourced to ensure they're meeting the need of all of those being tested? In other words, it's going to get busy right now. Have you got enough people, Rachel?
Yeah, so turnaround times are reducing now that we've got the on-island lab. Our average turnaround time, as you know, has been stated, the target is within 12 hours, and we're achieving that. So that's good news. In terms of the contact tracing and indeed the monitoring and enforcement teams, because monitoring people isolating is equally important. Yes, it is getting busier. We have some surge capacity, and we're also pursuing some short and medium term recruitments right now, as we know we need more people. At the moment we're coping, but we know that we need more people, particularly to be able to bring on for surge capacity as demands increase.
Okay.
But everyone can help us with this by observing good public health measures to reduce the transmission, and then it keeps everyone safe and it helps us to manage within capacity.
Right, I've got some details on the screen that I'm just about to put up there, which I think may be able to point people in the right direction of what they need to do and where they need to go. Hopefully this is the right one. Rachel, is this the right screen that I'm looking at right now? That gives the details?
Yes, that's the details about the expanded workforce testing, yeah.
So basically people just need to phone that number and it's harbour drive through and walk through. They can get tested. All the times are on there. We've had lots of people asking us if we can share this deck of graphs and also information. And with your permission, Rachel, I'd be quite happy to make sure that we do that through Chamber of Commerce as well. Alex seems to be nodding, so that seems to be good. The message seems to be at the moment that, and this is the final question, if you like, and I know we're running over time. Alex, if we do more testing, we're likely to find more active cases. If we find more active cases, people are going to get a little bit more frightened that things are on the rise. Is it just that we're discovering more cases now? If we do more testing, it's likely that numbers are going to go up, aren't they?
I think it is likely. We had a coincidence over September and October of relatively high passenger numbers and the case rate rising very significantly in the UK and other European countries. The border arrangements are not a fail-safe. Virtually no border arrangements short of closure are. And so some infections, either through weak compliance with requirements or indeed through viral incubation, will have seeded into small pockets within the community, which is what we're picking up now. So given the expansion of workforce testing, given the onset of winter, we expect to find more cases. But what we have to be able to do through the testing program is find them quickly and sort of press down on those numbers as hard as possible with the objective of trying to reduce significantly the threat to the island in this period up until Christmas. I'm not going to give a prediction on where we're going to get to with that, but I do believe with the right public behaviours, businesses as those on the call are engaged in the issue and doing the right thing, and with this really significant asset that Jersey has got in its fantastic test and trace capability, that we stand a very good chance of reversing the trend in the coming weeks. But I think people can expect the numbers to be going up over the next short period of time, for the reasons that you outline.
All right. Alex, thank you very much indeed for being with us, the Interim Director of Public Health Policy and Strategy. Rachel Williams, the Testing Programme Director. We had the Deputy Director of Medical Health, Dr. Ivan Muscat, earlier on the call. Matt Johnson, Director of Pharmacy at LV Care Group. Thank you very much indeed for being with us and for offering that alternative if it's possible for people. We will make sure that everyone on the call gets the slide deck so they've got more information, and if anybody needs to phone the helpline, it's 445566, and then they can book their appointment for workplace testing. We're way over time, but thank you to everyone on the call. The final thing, Rachel, is I will send you all of the questions that we've had, because we've had so many more questions than we could possibly ask during the 1 hour. And hopefully we'll get a response back from you and your team in between all the other busy things that you're doing. And we'll send that back out to all of the members on the call as well. So thank you all once again. It's been a real pleasure to have you with us today. Stay safe, everyone, and we'll have more from the Chamber of Commerce as the week unfolds and more webinars. Thank you very much. Have a good morning.